volunteers. My name is Becca Mitsos. I'm the Child Life Specialist at Ann and Robert H. Lurie Children's Hospital in the Surgical Services Department. I first and foremost would like to welcome you to volunteering with us here at the hospital. We so appreciate you donating your time and efforts to us and to our families and our patients. Nobody in the hospital could do their job without your help, so thank you so much for being here.
Hi volunteers, I'm Carly. I'm a Child Life Specialist in the Neonatal Intensive Care Unit here at Lurie Children's. Today we'll be talking about hand hygiene while you're here at the hospital. First and foremost, please do not come in to volunteer when you are sick. Hand hygiene while you're here at the hospital is the single most important measure for preventing hospital-associated infections. Please wash your hands before entering and before exiting every patient room. You can also use the antiseptic hand sanitizers located outside of every room and inside of every room. If you're required to put on any protective equipment, please wash your hands or use the antiseptic hand sanitizers before putting on gloves and after removing gloves. Please also wash your hands after sneezing, coughing, or blowing your nose. If you do need to sneeze or cough here while you're on your shift, please do so into your elbow, like so. You will be asked to wash your hands the first time you step onto the unit for your shift. This will be the most thorough hand washing of your shift. Be sure to do a vigorous wash with soap under warm running water for at least 15 seconds. Scrub between your fingers, around the tops and palms of your hands, around and under your nail beds, and around your wrists. To recap, washing your hands is extremely important while you're here during your volunteer shift. Please do not come in to volunteer if you are not feeling well or are sick. Please also wash your hands for 15 seconds under warm water with soap or use the alcohol-based hand sanitizers throughout the hospital. Please wash your hands or use the hand sanitizers before and after contact with patients. Thank you.
Question 1, what is my name? It's okay, I'll wait. No, just playing. I'm here to talk to you guys about isolation. Isolation is something we take very seriously here because we have a variety of gear that is designed, one, to either keep our patients safe or to keep us safe. It's a two-way street and we want to keep you guys safe. When you're going into a room, there's going to be a couple different signs that you can see. The first one's purple, and that one means come on in, man, wash your hands and go on. If you see a color other than purple, then that tells you what you need to wear. So don't worry. If you don't know what to wear, just look at the sign. Everything is right there. So here's some of the equipment that you'll see on the floor that we use to protect ourselves in isolation rooms. The first thing that you want to put on is your gown. And it goes on just like any other jacket, except if you put your jackets on backwards, of course. So here's a spot for your head and your arms. Maybe. Then the two ties wrap around you and then tie in front. So next, we want to put on our mask. Looks like this, hooks around your ears. And then this little wire part, go ahead and bend that around the bridge of your nose. And then finally, we want to put on our gloves. So now, before you exit the room, we need you to take all this isolation gear off. So the first thing you're going to take off is your gloves. So you take one off, and then hold it in your hand, and then you pull from the inside, turning it wrong side out. So all the gross stuff is in there. So the next thing that we take off is our gown. Don't worry about untying it. You can just rip it straight off. And then finally, you take off your mask.
Hi, I'm Brittany. I'm the Child Life Specialist for the 20th floor, which is an acute inpatient care unit. And I'm going to be talking with you all today about how to communicate with nurses when you're here volunteering at Lurie Children's. So the most important thing for you to know is that it's really important to continue communicating with the nurses while you're here volunteering. The nurses are an amazing source of information about what's going on with the patient that you're going to be entering the room of. So what you're going to want to do before entering a patient's room or moving a patient is talk with the nurse about if there's anything you need to know about what's going on with them medically. Now, I'm not saying to ask about a diagnosis or length of stay, but what it's important for you to know is if there's something going on that you shouldn't lift a patient or move them a certain way. So what you'll do is approach a nurse, and you'll be able to find out who the nurse is. Outside of the patient's room, there's a sign with their name and their Volt phone number. And you can contact them and say, you know, I'm so-and-so, I'm here volunteering. I wanted to go into patient X's room, and is there anything that I need to know, any positions I should be worried about with the patient, any body parts I should avoid touching or moving, just to keep the patient safe while you're in there playing. Another important thing is to not move or change positions of a patient without asking a nurse. If a patient is in a crib and you'd like to move them, always check with the nurse first about what you need to know as far as picking them up and moving them. Due to a multitude of reasons, you shouldn't be touching a patient or moving them without checking with that nurse first. If you call a nurse and she doesn't respond, then leave the patient in the position they're at right now and work on playing with them where they are. Another important thing is to never remove a patient from the room without asking the nurse first. This is so that the nurses know where their patients are at all times and they don't freak out when they walk into a room and the room is empty. So if you're planning on asking a patient to take a lap around the unit or wanting to take them to the Family Life Center, what you're going to need to do is make sure that you check with that nurse. Now, if that nurse isn't available and you see another nurse, you could ask them. They may be able to give you permission to remove the patient from the room, and they may say, I'm not sure, you have to stay there with them. Again, be adaptable, and then just find a way to play with the child in the position they're in their room.
It's important to know that each patient that comes here may or may not have an IV pole with them. That means that one of their lines, if not multiple lines, are hooked up to their pole. Each line has something different going through it. For instance, this patient has an IV, and his IV is giving him fluids from his IV pole. Different patients could have G-tubes that are connected to poles. They could have PICC lines or certain central lines that are connected. So it's important for you guys to know that each patient could be different, and there could be multiple different spots on their body that have lines. This doesn't mean that the patient is immobile and can't do anything, but it means that you need to check with the nurse before moving the patient and his or her IV pole anywhere throughout the hospital. So to recap, please always check with the nurse to make sure that you're aware of each line that the patient has and how it connects to the IV pole. And please always be aware of everything that you need to know prior to touching anybody's IV pole.
Hi, I'm Amanda. I'm the Child Life Specialist on the 21st floor. Today I'm going to talk to you about developmentally appropriate interactions. So anytime you're going in to work with a child, please knock on the door. So many people go in and out of patient rooms. We like to give families the respect and offer them the choice of having us come in or not. Please knock on the door and open it just a little bit so they're able to hear you say, hi, I'm a volunteer. Is it okay if I come in? If the family or child says, yes, come in, please enter slowly, observe what the environment of the room is. If it's quiet, please come in as quiet and start your interaction there. If the child's awake and playful, you can go in a little bit louder or more engaging. Something you might see at the bedside for some of our kids who have been here a while are these play plans. These tip sheets will be posted at the bedside and have lists of interaction cues or tips or things that kids are working on developmentally. Another thing you might see, this might be on the door. This is a welcome sign or kind of a comfort or coping plan for children. For some of our kids with special needs or differing abilities, there might be tips on how to introduce yourself, ways to interact with a child, or kind of some of their preferences that may be helpful. Sometimes you may see a sign posted on the patient's door that says, please check with nurse before entering. Sometimes patients are not appropriate for volunteers. If you see the sign, please make sure you have contact with that nurse to see if it is or isn't appropriate for you to go in. When interacting with a child, please be flexible in your interactions and your activities. Children often have a preference or prefer to make choices on their own. Allow them a couple options of what to play with or what activities to do and follow their lead. In all of your interactions with patients and families, please always be respectful. Remember, when you're wearing your vest, be at your best.
Hi, I'm Janine. I'm a Child Life Specialist on the 19th floor. Really briefly, we're going to talk a little bit about developmental versus chronological age. Many of our patients you're going to start to see are here very often. They're called frequent flyers. So the great thing is you're going to develop really nice relationships with some of our kids. But an unfortunate side effect is that a lot of these kids lose a lot of their development while they're here, which is why it's so important that we're here working with these kiddos. So when you're going to see a patient for the first time, you want to be careful about thinking about how you want to interact with the child. The census may tell you that they're 12 years old, but they may not be 12 years old developmentally. So a great way to think about it is going in the room, talking to the family, maybe talking to the child themselves if they're able to, talking to the bedside nurse. It'll give you an idea of where they're at, what they enjoy, what they can do. One other thing to consider is that oftentimes you can't tell just by looking at a child's age or gender. So a really easy way to always be sure is take a look at your census. It'll give you the age of the child and if they're male or a female. Some of our patients are developmentally appropriate, and you might find yourself hanging out with that teenage boy or teenage girl, but keep in mind this is still a children's hospital, and even if the patients are talking about things that may seem inappropriate, make sure you're keeping your conversation and your jokes still developmentally appropriate. To recap, never assume a child's developmental age, their ability, or their gender. You can talk to your supervisor to get more information.
Please be respectful, follow a child's lead, read the room, and remember, when you're in your vest, be your best.
Hi, my name is Ellen Donovan, and I work in the Family Life Center on the 12th floor here at Lurie Children's. And I'm going to talk to you today about being engaged with the patients. You're going to be working with the patients, so it's really important that you're there and present for them, not possibly thinking about something else or thinking about what you have to do later. Our goal is that you be engaged with them, working with them, and all of the people in the room. Our hope and our expectation of all of our volunteers is that they're very friendly and they're at, what helps you do that is when you're at eye level with the patients. Like if they're small, you can squat down to them. If they're in the bed, you can be right at the bedside and talking with them, not talking at them. The goal is that you have a very great conversation with them and you're engaged. Being in the present. Think of yourself as a present to them and you want to stay in the present. And don't be afraid to be silly. We love to be silly, but it is also important to recognize that every room that you walk into, there might be something different going on there. Now I'm going to talk to you about how to invite kids to play, because that's really something that they love to do. And it's important, what's great about it is that you get to offer them choices, which is really important to the hospitalized child. He or she doesn't always get choices, so playing is something that they can have control over. What you want to do is you want to approach them at their level, see what kind of things that they like to do. But instead of saying, do you want to play, a better approach is you say, look what I have. I've got the Bop It or I've got a book to read. Which would you like to do? This helps them make their choice. Do not be upset if a patient doesn't want to play. There could be many reasons for it, and resting is one of the most important things they need to do to heal. So they might not be ready to play. They might not feel good enough to play. They might just want to take a nap, and that's okay. Or they might be really shy. You can maybe try a couple of times, and if they don't want to play, that's okay. Keep it simple when you're offering to play with a child. You don't want to bring 10 things into the room. That could overwhelm them, and that could be too much stimulation. Just bring a couple of options. That way they can pick, and then you know they've picked the thing that they really want to do. And when you're bringing a toy or a game to a child, remember you don't just have to drop it off and leave it and leave the room. Stay and play for a while. Have a good, meaningful interaction with the child. That means so much to them. Your donated time is so valuable. So stay and get to know the child and let the child get to know you. If you stand at the doorway, that's really far and it's kind of like you're just checking in. So walk into the room, go to the bedside, and engage with the child. Then he or she will know that you really do want to play. Have fun.
Hey guys, I'm Jessica Marar. I'm one of the child life specialists here at Lurie Children's. I work at the Clark Deming outpatient clinics, providing procedure support and distraction and education for all of the clinics over there. Today we are talking about family-centered care. And as we know, when a child is hospitalized, it doesn't just affect them, it affects their entire family. Their parents, aunts, uncles, grandparents, and especially siblings. We know that normal, routine, and schedule goes completely out the window, and this becomes their new normal. This hospitalization, this environment becomes their new normal, and we want to help ease that for them. So Siblings, we want to make sure that they still have fun while they're here in the hospital. We want to give them the license to still be themselves, to laugh, to play. And by you being here and helping them get back to that normal routine, you're certainly helping the entire family cope with that.
Hi volunteers, I'm Laura. I'm the 18th floor child life specialist, and I'm here to talk to you about toy cleaning. All toys and games are thoroughly cleaned after each and every use. Any porous material such as blankets, stuffed animals, Play-Doh, those are one-time use only. So those go home with the patients, and they're only used by that particular patient. Toy cleaning is one of the most important jobs here at Lurie Children's. We appreciate and value everything you do for us, but we especially value the fact that you guys clean the majority of the toys here at Lurie Children's. Thanks for cleaning the toys.
My name is Robert Fry. I go by my nickname Bo. I'm an activity coordinator here in the Family Life Center, and I supervise about 150 different volunteers throughout the hospital. I'm here to talk about the different color codes in the hospital that you should know. First is Code Blue. Code Blue is for anybody that needs immediate medical attention and is not responsive. Code Red is for fire, and whenever there's a code red, you don't go through the fire doors. Code Green is go. It's safe to go through the fire doors, the all clear. Code Pink is a missing or abducted child. So your role in a Code Pink would to answer any question that a person in a position of authority asks you, and to go with them if they ask you to go and see where they went. Code Silver is an armed intruder. So your supervisor will give you further details of what to do when there's a Code Silver. Thank you.
My name is Heidi. I'm a child life specialist for the inpatient oncology, brain tumor, and stem cell transplant population here at Lurie Children's. We also take pride in all aspects of the care we provide, and for both staff and volunteers, this includes our dress code. First off, no shorts. Long capris are okay, as well as skirts and dresses that are knee length or below. Secondly, no open-toed shoes, ever. No flip-flops, no open-toed sandals. Think more along the lines of boots, sneakers, closed-toed work shoes, or closed-toed flats. No hats. Unless wearing a head covering for your faith tradition or another circumstance that you would then discuss with your supervisor or the volunteer resources staff. No tank tops or sleeveless or shoulderless shirts. No ripped clothing. Minimize perfume and cologne. Avoid these as strong smells can create nausea or other physical effects due to sensitivities created by treatments that patients are receiving. Be mindful of jewelry. Decrease the amount of rings worn on your fingers and engage in good hand hygiene practice to decrease the risk of infection. Take off long necklaces to avoid the risk of strangulation or choking for both you and the infant. So to recap, no shorts, no open-toed shoes, no hats, no tank tops or sleeveless, shoulderless shirts, no ripped clothing, minimize the amount of perfume or cologne, decrease the amount of rings worn, and take off long necklaces.
So let's talk about food, drink, and cell phones. Basically, don't have any of those during your shift when you're here at the hospital. No food and drink for obvious reasons, patient safety. We don't want to spill and make a mess. We don't want our patients having any of our food and drinks. A lot of them are considered NPO, which means nothing by mouth, it's Latin. But a lot of them are either pre or post-surgery or going through stuff that they just can't have anything to eat or drink. So we want to make sure not to bring any of those up with us during our shift. Another thing we want to make sure that you do not bring up to the floors on your shift is your cell phone and your tablet. So leave these in your locker or leave them at home. We want to make sure that you're 100% focused on the patients and families while you're here. If anyone needs to reach you while you're here during your shift, you can have them page your supervisor and they can get a hold of you. But thanks.
Hi guys, I'm Nicole. I'm the coordinator of the Family Life Center, and I'm here to talk to you about HIPAA confidentiality and boundaries. Information about patients is strictly confidential. We ask that you never attempt to get information about a patient or family that is not essential to your volunteer work. We also ask that you never discuss with anybody outside the hospital, never share via social media or other outlets. Please never discuss patient information in public areas of the hospital, such as the elevators, the cafeteria, the waiting rooms. In most cases, volunteers don't need to know the diagnosis or details of a patient's care. If you have concerns about your work with a patient, a good guideline is, what do I need to know to work well with this child and family? Photographs of patients and families are not permitted unless approved by the hospital with written consent from the parent or guardian. Always dispose of census sheets in HIPAA-secure shredding bins. Although you will come to know our patients very well, it's important to promote independence and not foster attachment or involvement. Please do not exchange contact information, phone number, or email with any patient or family. It's important to not accept invitations to outside events or visit at non-assigned times. Breach of HIPAA and confidentiality is cause for dismissal.
Your true colors, your true colors are beautiful.
This is an informational video that will hopefully help you with not just your first day as a volunteer at the hospital, but throughout your time here with us. Please feel free to refer back to this video at any point, and if you have any other questions, don't hesitate to ask your supervisor. Thanks again so much for being here.
Like a